Good morning. While all of you are logging on, and those that are on already, if we could have you be on mute, that would be great. We're going to start the recording and get everything going in just a moment. Just also would like to let you know that we would like you to put in the chat box any questions that you may have so that we can ensure that we can ask the questions. The way that that will be done, once you put it in the chat box, Desiree will be looking at that chat box and asking the questions for the various speakers as we have them coming up. So again, I just want to make sure that you utilize the chat box. And again, you don't need to ask the question. We'd like you to be on mute, and Desiree will be asking the speakers. We also have some people that are plugging in remotely a different way, and so again, we want to ask the question. So if you're a speaker or presenter today, allow Desiree to ask the question so that everyone that's on the call will be able to hear it, and then will be asked to respond to it. And it is officially 10 o'clock, and I'm just going to go ahead and start with today. We are recording today's meeting, and I did want to say thank you so very much for being on the call. We appreciate all of you. It is a jam-packed agenda. I did want to mention that, again, if you have a question, please use the chat space in there. And I believe our chairman.
I am.
Donnie, are you on two different systems? Can you mute everyone, Des? Or?
There we go. There we go.
Thank you. Thank you.
All right. Well, thank you, Bobby. And welcome to our weekly conference call. We appreciate everyone being here. We've really got a good response on this call. This is something that we're proud of doing every week, to invite everyone to come here and get updates from people who are have their finger on the pulse of what's happening here. We've had a very busy week. We're starting to reopen some businesses in Corona, and I want to start off by telling you that earlier this week, our executive committee voted to take a stance and to start encouraging reopening businesses in Corona as applicable, as is safe. I'm going to read you the statement that we issued. The board voted unanimously to send a message to the entire region that it's now time for Corona to open for business. The leadership advises business to open using the state of California and the Center for Disease Control guidelines. Safety for employees and clients must remain the first focus. Using safe and logical guidelines provided by official agencies, we are confident in encouraging businesses that are ready to open to do so. We have a strong belief that utilizing all safety measures makes it time to reignite our economy. So that is our stance, and that's what we're moving forward with at this time. A lot of things are going to happen in the next few days. Our featured speaker today, Eugene Montanez, is going to address some of those as time goes on. A couple other things. This past week, our Frontline Appreciation Group, our FLAG group, which is headed by Mary Barnett, who founded another brilliant idea, continues to collect funds to support our frontline workers. They bring them meals. Not only does it help the workers, but Mary's group is also using existing restaurants. They're not receiving donations to do this. They're actually getting and paying prices so that it helps our local businesses as well. To date, they've raised almost $15,000. And if you can see by the graphic there, we welcome all contributions for this. This goes through the Corona Chamber Foundation. And it's really been a success, and we encourage you to join in if you can. You can also give through Venmo, PayPal, Give Big Corona, or write a check to the Corona Chamber Foundation earmarking the FLAG group. So thank you to Mary and to the FLAG people. We had a flyover of the hospital this week. We had 2 flyovers actually. So this has been a real exciting week, and it's time to be cautiously optimistic, I think. And with that in mind, I'd like to introduce Jeff Gibson, who is really in charge of our advocacy outreach. And Jeff is with Occidental Communications Group. He keeps us informed and up to date, and I would like to turn it over to Jeff. If Jeff is on the call.
Let's go ahead and skip Jeff and we'll move on to the next one, Donnie.
Without Jeff here, I would like now to introduce our supervisor for the County of Riverside, Supervisor Karen Spiegel.
Well, good morning. Thank you for including us. You know, it is a beautiful day today, and we're looking forward to having many more as we move forward. I know that you have a program set for today with talking about reopening, but I do need to share the county's perspective. You know, we all realize 96% of the businesses in Riverside County are 50 employees or less. That's a very high number. We recognize that and want to help and do what we can do to get businesses open. They have to be open and safe and successfully. So we have submitted our readiness and reopening framework, as I shared last week, to the governor. They acknowledged they received it. Now we have to do what we call an attestation, which is a certification that we are meeting the numbers of their criteria. And those of you who are familiar with the criteria, there's a whole list, there's 6 of them. We have meeting probably almost 5 of them, a little question a little bit, but the ones that we have challenges with is we are just about almost 90,000 tests done in Riverside County. That's a lot of testing, but with that will come some positives. And so we have a lot of positives. We're one of the higher counties, but with the highest per capita testing, it will be. But our deaths are still up there just under LA. I mean, significantly under. We're not quite 300, we had 271 deaths. And that's a big number, but we are spread out through the county. Riverside, city of Riverside is our highest. Corona's, you know, medium. But with that being said, that's one of the criteria. So testing is a critical factor and contact tracing. And I just had a meeting with the sheriff just a minute ago, and he was explaining how they tracked where their positive came through the jails. And that's kind of a critical factor. So when we talk about contact tracing, some people are upset about it. They don't want to be a part of that, but that is significant, and going back and figuring out where the virus has come from. So with that being said, we have not heard back from the governor to be approved to open. I'm not saying for Corona not to do that, but as the Riverside County, we are not officially open at this time. We're hoping to hear back before the weekend. With that being said, understand that we cannot help if a business opens and they have any state licensing, that we will not be able to help if for some reason licensing comes in and their license is pulled, whether that's in cosmetology, medical, restauranting for ABC. Restaurants themselves are okay. Public health isn't going to come out. Riverside Sheriff's not going to come out. And as you know, the Corona PD is not. So people have to make their decisions on what they're going to do. And the other thing I do want to say is that we had before us yesterday at the board meeting a item with our CARES Act funds. We're going over those very closely, and I want to thank the Recovery Task Force that Bobby serves on that has their input. They served a letter and some recommendations. And at the next board meeting in June 2nd, we will be having a little more specifics on where we're going to spend that $431 million. It has to be COVID related, that it is not for the county revenue loss, which, as you know, we're looking at $100 million shortfall between the rest of this year and going into next fiscal year. So it's a challenge, and we can't use that money for that, which is good because we want to help small businesses. That's a big focus on some of our CARES Act funding. So with that, I want to pass on to Bruce Barton. He is our EMD. And Bruce, are you on?
Yeah, I'm here, Supervisor. Thank you very much. So I will just real quickly go through an update on the numbers. I think Supervisor already hit on the number of deaths. We're at 271. 11 of those are in Corona. Our total case count has gone over 6,000 now, 6,053. The good news is 3,871 of those individuals have recovered. So that are, you know, it's important to understand that almost 2/3 now of the people have recovered who have contracted the disease. Our testing continues to be very vigorous, as the supervisor pointed out. We now have 6 county sites up and running, 8 state sites, plus the testing being done at all of our 17 acute care hospitals. So we are almost at that 90,000 mark, which is over 3.6% of our population, and that does continue to lead the state. They are also working, public health is working on approval of an antibody study where we will begin doing the antibody testing. They are currently working with the academic community to get IRB approval to initiate that study. Our hospitalizations remain stable. If you look across our 17 acute care hospitals in the county, our total hospital inpatient census as of yesterday was 56.2%. Our ICU utilization is 78.4%. So those are both trending downwards. Total across the entire county, we have 195 patients in hospitals and 68 patients in ICUs. Those numbers are also down from historical trends looking back across the last couple of months. We do continue to see a number of patients in our that are COVID positive in our skilled nursing facilities. Total across the county, 568 patients remain COVID positive, 270 staff. So that continues to be one of our primary operational focuses in our skilled nursing facility outreach support teams. Our SOS teams are continuing to visit 15 or 20 skilled nursing facilities per day, teaching them how to don and doff PPE, providing them PPE, teaching them how to cohort or move patients around, clean, disinfect, as well as we have somebody from our mental health department that goes around and discusses some of the fears people may have related to treating patients that are COVID positive or just getting through the stressful time. So we will continue that to be an operational focus. Our EMS call volume, 911 call volume continues to be down by 10 to 15% every week, and it's the same this week. So we are continuing to monitor that. Our EOC priorities are, we continue to support testing sites. We're supporting our feeding and sheltering programs. We have a large mass care and sheltering program here in the EOC, as we've mentioned before, including the Great Plates program that is really starting to ramp up across the county of Riverside. And we continue to monitor our healthcare system for impacts. One of the things I will mention that you will catch in the media today is we are starting to see Imperial County patients that have really overrun those 2 hospitals down there. These are mostly patients that are coming up and crossing the border. We are starting to see them now be transferred from hospitals in Imperial County to hospitals in Riverside County that have the capacity to be able to take care of them. So that is something that we will be monitoring very, very closely. And the supervisor did a great job of covering the state's criteria, so I won't reiterate that, but I am available for any questions.
Thank you very much. Desiree, do you have questions for Director Barton or for Supervisor Spiegel?
Yeah, let me just get back here. This one's for Supervisor Spiegel. After Riverside County lifted many of the regulations, what mandates are left in regards to bringing employees back for working from home?
I don't believe there are any. Once we have it lifted from the state and we've been given permission, I believe that all the mandates, we are now in line with the state. So once the state allows it, then we are in line with the state. Except for your plan, I think Eugene will be talking a little bit about recommendations for a plan with masks and social distancing. So whatever's covered in the plan that's been approved.
All right, and then Supervisor Spiegel, did the state say how long for them to get back to the county?
No, and that's our challenge. You know, we're following up on a daily basis. We're answering whatever questions are needed, and it's very frustrating that we have no information. They basically said they received it, and that's as far as it went.
Gotcha. And then one more, and I believe it was already answered. It's, do we have numbers on the percentage of hospital beds that are being used countywide for C-19 patients? And I believe Chief Young got back to that question in the chat.
Well, no, because that says 3,560 licensed bed. Bruce, do you know how many, the percentage being used for COVID patients?
Yeah, so we have 3,560 beds, and there are a total of 195 COVID positive patients. So I could do a percentage of that real quick, but that's basically the numerator and the denominator. Let me just do some real quick math there. So that's 5.4% of the total beds. In ICU, we have 68 patients, and we have a total of 385 ICU beds. So that's 17.6%. So it remains a small percentage, but you know, from a hospital perspective, these patients take a lot of time, a lot of effort, and a lot of PPE from the staff. And they also have to be isolated from other patients in the hospital. So it's a small percentage, but it still represents a pretty decent workload for the hospitals.
Okay. And one more question came in. Do we have to submit anything to reopen? I know gyms have restrictions.
If you meet the requirements and you do the safety standards with whatever your industry is about masks and social distancing, then there's no submission directly to somebody as long as the county has been approved by the state to open. There's no way we can go around to all the businesses, but we give you recommendations. I think Eugene will be talking about that. It is highly recommended to include masks in whatever industry you are.
Right. There's no more for.
Thank you, Supervisor Spiegel, and thank you very much, Mr. Barton. We appreciate the time. And at this time, I'm going to go back to Jeff Gibson. Okay, he sent a question in, so I believe he's here. Okay, failing that.
I unmuted him.
Okay.
Yep. Okay. I'm up. Having
You're
some
on,
computer problems this morning. Kind of like the budget problems the state is going through. So the state legislature is in session. They've reported that we are at a statewide utilization of hospital beds of about 4%. At this point in the crisis, we were looking at about 180% statewide utilization. So the governor went through the process that we all are living through, and we don't need to review that. But we are well below. Obviously 4 is a much smaller number than 180. So the legislature is starting to walk through precisely how those dollars were spent. They've already found several cases of misallocated resources based on no bid contracts. You're going to start seeing a lot of news about that. There was a $1.2 billion contract that the state of California and the state of Maryland had blown up yesterday by the FBI based on PPE that did not ever materialize. So that's probably one of the things that you're going to be seeing a lot of. Secondly, you're going to start to see state policy driven by what is happening in the states that are ahead of us in phase 2 and phase 3 openings. And as those states see their businesses reopen successfully, see that as they relax other standards, several states have started to move away from masks and in some cases social distancing. I'm not suggesting that that's anything that you should do in your business, but I'm relating the experience of some of those other states. As that occurs, obviously California does not live in a vacuum. And so right now, about 75% of states have some form of phase 2, phase 3, or fully open. So that's about, even though it's about 75% of our population, it's about 60% of our economy. So as those states move forward and are experiencing rates of infection, and these are major states too, Texas, Florida, Georgia, have all had large case populations. They have urban areas in environments very similar to ours. So these are not just states where, you know, the joke in Montana is they've been socially distancing for 150 years. So these are major locations. So in any case, so the state is now also dealing with the $54.3 billion budget shortfall. The governor has proposed $12 billion in cuts. Most of those cuts, the first set of cuts, are on public safety and teachers. He's proposing a 10% across the board cut to public safety officers and teachers in pay. I think anyone who has been active in politics for any amount of time knows that generally, while proposed at the beginning of a budget cycle, is not what ends up becoming imposed at the end of the budget cycle. So that process is just starting. What the state of California is going to do is it's going to engage in a two-phase death by 1,000 cuts budget design. The first will be passing a placeholder budget by July 1st. Now, Supervisor Spiegel on the call or Mayor Steiner cannot pass a placeholder budget per se. They're legally required to have a balanced and active budget on the opening of their fiscal year on July 1st. The state will pass a placeholder budget sometime in June. They'll come back into full session in August and pass what will realistically be the budget based upon whether or not the federal government has given aid to the state. And the state is looking for general aid. They're not looking for disaster aid, as if when we have wildfires in California and the feds come in with aid to make sure that firefighters are paid or that firefighters can come in from other states. That's specific FEMA-led disaster aid. What the state of California is interested in now is actual fiscal aid on an ongoing basis for 2 to 3 years in the amount of about 200 to 220 trillion, or 220 billion dollars is really the totality of the request over the next 4 years. So that has never occurred before in American history. So take from that what you will. So we'll see where that ends up. But in any case, very happy to discuss anything with you.
Thank you, Jeff. We're making history. Desiree, do we have any questions for Jeff?
No, we do not.
Okay. Jeff, thank you very much. We always appreciate hearing from you. At this time, we would like to turn it over from the Riverside Medical Clinic, our health care update from Judy Carpenter. Okay.
She is on. Just a second. Judy?
Go ahead, Judy.
Can you hear me now?
Yes. Can you turn your phone off?
Is that better?
There you go.
Okay. I'm having trouble hearing you, so I'm hoping you guys can hear me okay.
We can hear you. Let's go ahead and bring her back in a little bit.
Yeah, sorry. Let me work on this
No
end.
problem. Okay, Judy, we'll get back to you. All right, we would like now to turn it over to our mayor from the Corona City Council, Jim Steiner. Okay.
Now we'll get him. Hold
How's
on.
that, guys? You got me now?
We do. Yes.
Okay. Try to go through this quick so we can get to Eugene's presentation. Our local food pantries are beginning to see a slight decrease in community need, which is a good sign. The city, nonprofits, and faith-based communities are watching this trend closely. The American Bankers Association has provided a comprehensive list of all financial institutions and COVID-related financing options. Please contact Ryan Cortez if you'd like a copy. The organization Grant Space has put together an updated list of emergency financial resources for nonprofits, artists, and small businesses. It's becoming very apparent and understandable that our business community has run out of patience. And I just want to remind you that since the state and county orders were issued, we have not issued a single citation related to COVID-19 to a Corona resident or business owner. Our position has been and still is one of seeking voluntary compliance. Many of our business owners are making the decision to reopen early, and Supervisor Spiegel touched on it, that you got to be real careful, with the state. They could come in and yank your liquor license or your salon license or any other type of license that's issued by the state. And we haven't heard that this has occurred anywhere in Corona yet, but I just wanted to reiterate that, you're taking a chance of losing something pretty important if the state comes in and gets you. Tonight at our city council meeting, we're going to be discussing the possibility of relaxing some more code enforcement regulations in regards to signage and window coverings in an effort to help these businesses let everybody know that they are open and advertise. That'll be a temporary thing with the signage. And also we'll be discussing how we can assist businesses with setting up outdoor dining in their parking lots, just to be able to expand the limited capacity that they're going to be allowed inside to outside. And then finally, I have another meeting with the Riverside County mayors at 11 o'clock today, just to continue brainstorming and trying to bring a united message to reopening our economy. And fortunately, we're going to have Congressman Calvert's going to be participating in that Zoom call as well. So with that, are there any questions?
Any questions for Mayor Steiner?
No questions for Mayor Steiner.
Okay, then I'll turn it over to Chief Young.
Good morning, everybody. Just a few quick updates for you. So we're hearing about preparations to get everything back online. The same is holding true with the city of Corona. We've put a bunch of measures already in place in preparation for the opening of publicly facing services. A lot of the plexiglass shielding is put in place. You'll see some of that tonight at the council meeting if you watch online, as well as a significant amount of signage, as well as we prepare for the next phase of the reopening. Happy to report that City of Corona personnel remains free of any positive cases. So very grateful for that. And we are continuing our community outreach and contact with our at-risk facilities and our long-term care facilities. I think one of the real positive testaments to this is we have over 830 positive cases in those long-term care facilities throughout Riverside County, yet we're only showing or tracking 3 total in the city of Corona. So that is an awesome testament to the diligence in those facilities and our ability to communicate with them, both at a local level and at a county level. And then lastly, I am happy to report that we're in the final stages working with emergency management and a lot of Bruce Barton's staff to establish a Corona testing facility. We do anticipate that opening early next week, and we are excited to be part of that larger group of 6 county sites and then the 8 state sites. This will be one of the 8 state testing sites, so that'll go up to 9, but that will be opening hopefully on the 26th or the 27th of next week. End of report.
Thank you, Chief. Desiree, do we have anything for Chief Young?
No questions at this time for Chief Young.
Okay, thank you, Mayor Steiner and Chief Young. Now we'd like to go back to Judy Carpenter.
For our little mishap earlier, I just wanted to let you know that I did contact Mark at Corona Regional as well to try to give you some joint comments, since I'm really representing the physician side of the house. But we are continuing to see patients. About 90% of our visits right now are telemedicine on an outpatient basis. One thing that Corona Regional is seeing, as well as the other area hospitals, is that the acuity level of non-COVID related care is going up, that patients are waiting too late to seek care. Our thought is that they're just fearful to seek care because they're afraid of coming in contact with someone with COVID, and we really need to put those fears at ease. We've all have put in measures to separate any COVID related care from the general care, the rest of the care that needs to be provided. So to the extent that we could really encourage people to seek appropriate care and try to lower that acuity level going into the hospitals would really help. I know that we've all started back doing non-essential surgeries, or what we refer to as elective surgeries. There's strict criteria in place. All patients have to be receive a COVID screening and be cleared in order to have surgery. And then they're being asked to self-isolate until they actually do go in for surgery, from the time they're tested until their surgery time occurs. Right now, we have an adequate supply, as well as Corona Regional and PPE. I know we're all a little worried that if we have another surge, that's not going to be the case. And by adequate, I would say that no one's overstocked. We're just able to take care of what we need to on a day-to-day basis, but we're all still working on securing more. And Corona Regional did want me to report that they do not have a ventilator shortage, that they're doing well as their ICU is maintaining. They've had 901 patients tested, 77 were positive. They currently had 26 that required hospitalization, and 7 of those are in-house right now. And they did have 10 deaths related to COVID, and most of those patients either had comorbidities or came from the nursing homes as well. So we're really all trying to work together and do what we can to provide care and make sure that the community is safe from a medical standpoint. So I don't know if anyone has questions.
Thank you, Judy. Desiree, do we have anything for Judy?
We do not have anything for Judy.
And so, Desiree, I did see a question pop up from Teresa, I believe it was, about obtaining PPE on it, and I'll happy to reach out to her and help her.
Okay.
Correct, yeah. And some of the callers on have inputted into the chat that they can be contacted as well for PPE.
Okay, great.
Thank you very much, Judy. All right, as we started our meeting and discussed that here at the Chamber, we're encouraging businesses who are can and ready to open to do so. And you both heard from Supervisor Spiegel and Mayor Steiner the cautions regarding that, and we agree there is a caution to be considered before you do that. To address that, as the topic of this meeting is a member of the Corona Chamber Commerce Board of Director, a longtime businessman in Corona. Here's a fellow that started something when he was in high school. He made it his livelihood, and he's been with the ups and the downs and the sideways. Him and his talented and lovely wife, Paula, who I'm happy to see earlier I was on the call. But at this time, I'd like to turn it over to our former city council member, Eugene Montanez.
Well, thank you, Donnie, and thanks everybody for being here. And yes, I will go over some of the cautions and warnings that both Jim and Karen had mentioned. Can everybody see the screen here?
Yes.
Okay. We'll get started here with the, some of this was prepared by our franchise headquarters, and some of it is from here. One of the things, I see Gordy's on the call too, this is not a sales pitch in any way. And one of the things I think we've learned through all of this is to shop local. And Bobby and I talked about that, and that'll be something for a further call. But regardless of whether it's something I talk about, anybody else talks about, please encourage anybody to, if they're going to purchase anything, to try to buy it local. I think we've all learned that buying things from overseas is really not the way to go at this point. Some of the things for a business to get going is really how do you prepare everything and what do you do? And so some of it is obviously the physical space for your employees, because your employees have to feel comfortable coming to work. Obviously your customers, if you're going to have people coming into work, and then, you know, how you're going to reach out to prospects existing customers when most of them aren't going to let you go out and do sales calls anymore. This checklist, by the way, I forwarded it to the chamber, so everybody that's on the call will get one of these. If you have specific questions about any of this stuff, because I'm going to try to go through this pretty quick, feel free to give me a call or drop me an email after we're done so we don't take up a lot of time here. You know, these are just some of the things that are common sense. And as we move forward, you know, there was at least one restaurant in Corona that opened that has an ABC license, and evidently the ABC did pay them a visit. So really, you have to be careful and you have to use common sense. And that's really what all this is. You know, if you're going to have employees wear masks and ask your customers to wear masks, even if it's optional within the county at this point, I think it's common courtesy that if somebody comes in with a mask, it's common courtesy to have one. If you need screens, protective screens for employee safety and visitor safety, that's something that a number of companies, we're doing them, other companies. If you think there was a toilet paper shortage right now, there's an acrylic plexiglass shortage. You can't find it. So if you're looking for any of that stuff, we can help you, and a number of other companies here in town can help you. You know, gauge whether you're ready to open or not. Most of the businesses in town that don't have state licenses, some of the things that, you know, Karen and Jim aren't really openly saying, but really the state, the county and the city are not going to be the force that's going to come shut a business down at this point. It's going to be, you know, if you have a state license, whether it's ABC, cosmetology, anything like that. Other than that, you know, I think if you're in the city of Corona, I think as long as you take the proper steps, in my estimation, I'm not an attorney, I'm not an OSHA inspector, but as long as you go through common sense steps, that I think you're getting ready to open. So these are some of the things that you can look at for outside your business. You know, do you need to change the parking? Do you need to, you know, as Jim mentioned, the council's going to, and I want to applaud the council too for looking at the innovative ideas that a lot of us have been proposing, you know, putting restaurant spaces in parking lots. ABC has now going to allow that if they submit a plan. So people can feel comfortable. You don't have to be indoors with an air conditioning. But then that brings other issues, you know. Are people going to have to walk further to get there, and they're going to be grumpier because they're having to walk further, even though they've been sitting around not doing enough exercise for the last couple of months? But these are all things that you kind of need to keep in mind how you're going to deal with the outside. Do you need decals? Do you need A-frames outside? Do you need signage? And are you going to limit how many people are in a business? I'm sure all of us have been by businesses other than just, you know, Sam's Club or Costco, where they're limiting people to go into the business. So those are things you have to be aware of, especially restaurants. As restaurants open up, you know, there's going to be a really big demand. I think we saw it last weekend with the opening of the one restaurant in Norco. Goodfellows has opened up. I know IHOP is planning to open this weekend. Silver Dollar's planning to open this weekend. I think Cowboys Surfer Grill's looking to open this weekend. But these are all things that we all have to be cognizant of. They're going to be limited in how many people are going to be able to sit inside, and even the ones that have some outside seating. So we're going to have patience. We're not going to be able to just walk up to a restaurant and expect to be seated. And this goes into some of the interior stuff that you have to have ready. You know, all the different things. Again, whether you need to have a sneeze guard at the cash register, or if you don't have a cash register at your front counter. Do you need to have a hand sanitizer station? Do you need to have, you know, hand washing signs? You know, all these different things, both for your customers and your employees, because a lot of employees are, you know, questioning, you know, is it safe to come back to work? So we need to be able to make sure and address the needs of both the customers and the employees. Again, more for the inside of your business, you know, making sure that you have hand soap, that you have hand sanitizer. I mean, all those things are hard to come by, but just make sure you have those available so you're able to make, again, the customers and your employees feel comfortable. You know, we're in a totally different business than we were 4 months ago. I mean, we're doing masks. I mean, we have a couple years ago, we installed a laser cutter. So we're able to cut acrylic. We're making acrylic face shields. You know, we're selling masks primarily made in the US. I mean, all these types of things that we would have never thought we were in the business of doing just a few months ago. More other things, you know, do you want to have a bell to ring for assistance? If you're not quite ready to have people come in, do you want to have drop off and pickup areas? You know, those are all the different types of things that you need to keep in mind and how you're going to do it. You know, I was in one deli the other day and they were handing out gloves to customers. So everybody that came in, they expected them to wear gloves. I mean, you just have to be able to be flexible and not feel offended if a store has different rules and you decide to come up with a different rule in your store. Don't feel bad. I mean, if you feel that you need to do something to make your employees and your customers feel safer, do that, you know. It's better to be a little bit more careful at this point than being careless. So all these different types of things that you can do. I mean, who would have ever thought pens? I mean, right now, if you give a customer a pen to sign for something, you know, generally you're going to want to give them the pen and have them take it with them rather than have it stay and cross-contaminate. So those are all things that none of us would have thought of just a couple months ago. You know, getting the word out as far as marketing, that's something that everybody's going to have to take and keep in mind. What are you going to do in this quote unquote new normal? How are you going to deal with trying to get out there? Is it going to be social media? Is it going to be direct mail? Is it going to be signage? And again, thanking the council for being open to allowing, hopefully if they vote for that tonight, you know, more banners and being, you know, as long as, again, use common sense, make it look clean. You know, if you're going to put up a banner, make it look nice. If it starts getting ratty, take it down. You know, I mean, it's just common sense types of things that you need to keep in mind. And then that's pretty much it. I just wanted to close before we have some questions of, you know, why we do what we do. Some of you may have seen last Friday, we were one of the first at the Van Buren Drive-In. So the boys were able to, our grandsons, Royce and Archer there, were able to experience a drive-in theater. And then if you take a look here on this right, and if I can stop the screen sharing, that cabinet on the right, if you look right behind us, the cabinet behind Paula and myself, that was actually a cabinet from my grandfather's store that he had in Los Angeles, where they had a little market in front of their house. And that was over 100 years old, and Paula had it refinished, and now it's here in my office. So, so anyway, again, thank everybody for being here. If you have any questions, let me know. What was there any other notes I didn't cover? Oh, Cars and Coffee. I mentioned IHOP is planning to open this weekend. Cars and Coffee is moving from Saline to IHOP's parking lot. That will be this Saturday from 7 o'clock to 9 o'clock. So if anybody wants something to do and stay socially distanced, come on by there Saturday morning. Ryan at the city, Jim mentioned Ryan Cortez at the city. If anybody needs further details and help getting into more details, please reach out to Ryan. And then also one of the things that the state's requirements for the county to get all this lifted is percentages of positive versus negative tests. And as the chief said, and as Karen mentioned, if we can all get out and get tested, especially if we're a negative, that actually brings that number down and will help us reach the threshold that we're going to need. So I would encourage anybody, especially as that station comes in Corona, there's one in Norco, there's one in Elsinore already, and there's one on the far side of Riverside. But I would encourage everybody to get tested, because if we can't get the state to lift the orders sooner rather than later, getting that testing number down is what's going to help us, at least with one of those metrics for the state.
Thank you, Eugene. Appreciate it. Desiree, do we have any questions for Eugene?
No questions for Eugene right now. But you know what, can I ask a question for Supervisor Spiegel about clean testing? Supervisor, are you still on?
Unmute, Supervisor.
I unmuted her. Go ahead, Karen.
Can you hear me?
Mm-hmm.
Yes.
What were you going to ask now?
About clean testing?
Clean?
So
Clean
the testing of if they're well, if people are well.
Oh, asymptomatic. So it means you have no symptoms and you're, well, we want everybody to be tested. And I think Eugene really hit the nail on the head. And that is, the more tests we do, the higher our percentage of positives. So if we continue to do asymptomatic testing, it will help in our criteria testing, because we were the first county testing asymptomatic, which means you don't have the symptoms. Now, we do have people who test positive, even though they're asymptomatic, but that's a good thing, because we want to make sure that we do have that testing so that you know if you're positive, you're not going to infect others. And that's a key factor in this whole thing. So we're pushing testing. Please make sure you go out there. It's just a few minutes. You make an appointment online. You'll be there, get it done. And I think it's going to be also a little relief for those of you who aren't sure. And as antibody testing becomes a little more recognized, we can find out if you've had it before. But right now, we just need to get the testing up, because that is a big criteria. We're just falling just under our numbers that we need to have.
Right, and that's going to be one of the key things to get our state licensed people, ABC, cosmetology, barbers, to get all of them open, is really to get all those metrics that the county has to meet. At least the governor changed them last week or the beginning of this week again. Hopefully he'll look again and see some of the other metrics and see a bigger county like ours, it doesn't have to have the same metrics that a small county has. So hopefully that'll still change, but one of the metrics we can all change is by testing.
And then I just wanted to throw in that, a written plan for your employees to return to work is very critical to do. I know that Chad put in the chat box about a training that he was part of for an hour and a half for manufacturers. If anyone is seeking any of this type of training, please let me know, bobby@mychamber.org, and then we can try and coordinate with some experts. Again, all of our speakers that have been on today have voiced from their opinions and their expertise, and we so appreciate it. Eugene and Paula, thank you so very much. Supervisor, my wife, Karen, thank you. I get choked up on that. So to Bruce, to Judy, to Chief and the Mayor, Jeff Gibson, thank you guys all for participating. What I'd like to do, I don't think there's any more chats in there. I'd like to just mention that we had just shy of 70 people on this call. We're very excited to do this every single week. And I'd like to go ahead, Desiree, if you can share that slide, and we'll go ahead. And I want to just talk about the new norm. And we are very optimistic. We've got a tradition of having a golf classic, and that will be on Wednesday, August 5th. We do have some sponsorships and tee foursomes available. So please go ahead. It's there on the website. All the bit.lys, by the way, are case sensitive. So be sure and capitalize what is capitalized on that bit.ly. If you've got questions, give us a call at the chamber. The next slide is our Good Morning Corona breakfast that will be in June. This will be a graduation of our Executive Leadership Roundtable class, and we are very excited to have everyone kind of get back to normal. We are open for business. We're very optimistic that by June 19th, that things will be very relaxed from a standpoint that Eagle Glen will be able to host us up there. If something changes, we will notify those people that are registered. But the best thing that you could do now is go ahead and register. We're talking about 1 month from now. A lot of changes are happening day by day, and positive changes. We need to get back and be able to do things. We will seat people according to whatever the guidelines are at the time. And our next slide, I'd like to just mention that if there is anyone that is possibly on the call that is not a member, or you know someone that's not a member, there's no problem at all. All you need to do is get a hold of Robert Yanez, and he will totally be able to connect the dots and help you become part of our chamber family. So with that, I just want to say again, thank you so much for being on this call. And we look forward to having Corona reopen and all the businesses thrive again using common sense and being sure to have everyone take care of themselves, take care of their staff and their clientele. Have a great day. Thank you.
Thank you.